Good evening to all the viewers who are watching live and will be watching on the backstage. We are extremely sorry for this delay because we were facing some technical issues and also some internet issues, and we are very sorry for this delay. So we have lost many times. Means we have lost a couple of times, like 18 minutes. So without wasting any more time, oh, let me just tell you this. We are not announcing the CME winners since we didn't publish on time. Our IT team didn't publish on time the main CME posters. So we are sorry for that, and I hope you will be getting soon. So without wasting any more time, let's just jump into the 37 countdown time as usual.
Good evening, sir. Good evening,
Good
all
evening.
our respected viewers across the globe. And we are extremely sorry and apologize for our unnecessary delay tonight for 17 minutes. Our respected viewers are waiting since long, as we see in the chat. And sir, starting 2 years back, we are slowly but steadily creeping towards our half century mark. And today is our 47th live CME online. And with your permission, sir, Dr. Devnaran Kalyani, our co-host and our president tonight, myself, Dr. Bidyut Mukherjee. With your permission, sir, let us call upon today's inaugurator.
Sure. Please call it.
Sir,
Please start.
Dr. Professor Karuna Roy. Over to you, Dr. Karuna.
Thank you, sir. Good evening, sir. Dr. D.L. Kalyani, sir, President of NI's Alumni Association. Good evening to Bidyut. Good evening to our moderators, speakers, and all viewers. This is our 47th online live CME by NI's Alumni Association. Welcome to our moderators, Dr. Himanshu Shekhar Tiwari, Senior Medical Officer of C.G.H.S, New Delhi. Welcome to our speakers, Dr. Vivek Bharti, Medical Officer of RBSK of Jharkhand, and Dr. Pralay Dutta, District Consultant of Public Health, Darjeeling. Today, Dr. Vivek Bharti shares his experience about the constitutional remedies in the treatment of nails and hair. As we know that nails and hairs are appendages of our skin, but many conditions that may be local or systemic disease like iron deficiency or skin disease like psoriasis that affects the hair and nails. Hair is simple structure, but it has important function in social functioning. Now, Dr. Vivek Bharti show you different cases of nail changes and deformities like black nails, cracked nails, thick nails, brittle nails, and spotted nails, etc. Also show you the different cases of gray hair, falling of hair, and their homeopathic management. So, most welcome, Dr. Vivek Bharti. Another speaker, Dr. Pralay Dutta, shared his clinical experience about the rheumatoid arthritis and its homeopathic management. We know rheumatoid arthritis is a chronic, non-infectious, inflammatory, autoimmune disease affecting joints, in which immune system mistakenly attack the own cell and tissues. Normally, body has tolerance about self-antigen, but when the tolerance decreases, Immune system fails to recognize the body's own tissue as self. Then the autoimmune disease like rheumatoid arthritis develops. If we study the clinical course of rheumatoid arthritis patient, then we see that there are exacerbation and remission. And pain is the most prominent or severe manifestation. Dr. Pralay Dutta represent how to manage the pain in the different cases of rheumatoid arthritis. Also say that how the lifestyle management also maintain this type of serious cases. So welcome Dr. Pralay Dutta. Now I hand over to Dr. Mukherjee. Vidyut. Namaste.
Good evening and thanks so much, Professor Dr. Karuna. And she had been a very excellent student during her UG course in NIH. Sir, with your permission, let us bring upon Dr. Himanshu Shekhar Tiwari, who had been with our CME online program. He has been speaker during the tough times during COVID twice. He had been a speaker with online, and now tonight, he is our moderator. Sir, let us bring
Sure,
upon Dr. Himanshu Shekhar Tiwari.
sure, please. Himanshu.
Good evening, Kalyani sir. Good evening, Bidyut, and good evening to all the viewers as well. Should we start the session, Bidyut?
Yeah. Yes, please go ahead. You call upon the speaker because you are the now master of the show, being the moderator. Each speaker will
Thank
have
you.
40 minutes. Question answer session will be at the end of after both the speakers complete. You know that. You know that. Over to you,
So,
Dr. Himanshu.
okay. Thank you, Bidyut. Thank you, Kalyani sir. So, let's begin the presentation today. I would like to call upon Dr. Vivek Bharti for his presentation on constitutional remedy in treatment of nails and hair. And he is a very esteemed clinician. And let's hear him. Over to you, Dr. Vivek Bharti.
Thank you, Himanshu. Good evening to all, Dr. Bidyut, Dr. Kalyani sir, and my friend Pralay Dutta. At first, I started constitutional remedy in the treatment of the hair and nails. Structure of nail plate, nail groove, lunula, eponychium. Importance of objective symptom. Objective symptom can't lie. There are certain indication that certain morbid process is going inside the organism. Prognostic value, valuable in case of children and unconscious patient. Human nail found by invagination of epidermis on dorsum of the distal phalanx of each digit. These are visible in 9th week old embryo. The nail plate is almost completely formed by 20th week of intrauterine life. Growth of nail is maximum in childhood and decrease in adult with age. Normally fingernail grow 3 mm per month. Precaution while dealing with nail deformities. While considering the deformities of the nail, first we must eliminate the peculiarities of the nails due to cosmetic or trade, including that of housewife or injury or even tobacco. Diagnostic value of nail deformity: clubbing, sign of chest trouble, cyanotic, certain type of heart disease, raging longitudinally, endocrine deficiency, emotional overstrain and kidney involvement, white spot, myocardial hearts and absent annually heart involvement, horizontal wavy depression, acute illness and wear away without return, little hollows, number of cases, combined hyperthyroid and heart disease, split acidity, mathematic diagnosis through nail, thick crumbling misshapen nail, psychotic diathesis, soft, easily tearing nail, tubercular habit, brittle nail, psychotic or indicates a disturbance in silica content. Myasm, psychosis in general, overproliferation or metabolic disturbance of nail. Syphilis, deformed or misshapen nails. Some type of nails, black nails, medicine, arsenic, cum album and graphitis. Cracked nail, antim crude, netremure or silicea. Split nails, antim crude, silicea, esquila and sulfur. Crumbling nails, sepia, silicea or thuja. Brittle nails, alumina, umbra, calcarea, osticum, equisetum, diascorea, fluoric acid, graphitis, nitric acid, soranum, silicea, esquila, sulfur and thuja. Normal nails, dry brittle nails. This is normal nail, this is dry brittle nail. White spots on nails, firstly silica, but also nitric acid, sepia or sulfur. Spotted nails, alumina, arsenic and tuberculinum. Hang nails, calcarea, lyco, some medicines are here, mercurius, netremure, rustux, sabidilla, sepia, stenum, sulfur and thuja. One case, delicate flower-like lady of 45-year age came for chronic constipation, stool, receipts, BP and desire cold food and ice cream. Stockings always damp, nervous and poorly before and during thunderstorms. Lack of self-confidence, fastidious, frequent colds, boils and veins. Teeny warts, succession of styles, nails very delicate and constantly breaking, hairy, dry and brittle. I give him Silicea 206 dose, BD 3 days. After 2 weeks, nails stop breaking. After 2 weeks, Silicea 1 m 1 dose given. After 1 month, nails become fine and complete stop breaking. Other symptoms greatly improved. After 2 months, nail becomes brittle again, and on repetition of Silicea 1 m 1 dose become normal and have remained so. some type of nails, clubbed thumbnail, depressed nail, medicine magphos, dirty yellow nails, medicine salicea, flat nails, fluted nails, all nails fluted clematis, thumbnail, nectamure, thumbnail which rise in front, nectamure, moon type nails, disease of the nails, white dot on the nails. In each of these incidents, the condition of it hair and nails had been but one objective symptom is the totality, yet it is helped to guide to the truly remedy, and the change in the hair and nails has been gratifying and amazing to the patient. Human hair, 2 rows, upper lip and chin at about 9th week of embryonic life, and in other region at the about 4 months. Hair grow at the rate of approximately 1 cm per month. Miasmatic diagnosis through hair, mossy or lusterless hair, tuberculosis. Loss of hair unless after an acute disease in young people, especially in the patches. Syphilitic diathesis. Soda, Myjum soda, a single white streak in hair. Psychosis, fine, silky hair, bushy, wiry, crinkly or unruly hair. Mossy hair, this type of hair is mossy hair. Medorinum, Soranum and Thuja is the medicine. Matted hair, medicine, Megaerium, Netramure and Soranum. Easy tangling hair, borax, fluoric acid, graphitis, Soranum and Zincum metallicum. Easy graying hair, Lycopodium. If in the spot, Soranum. Falling of hair, arsenic, antimicrobe, automate. If in a spot, fluoric acid. Baldness, Brachycard, in babies, Salicea. This is the stages of the baldness. First stage, second stage, third stage, fourth stage, stage 5, stage 6 and stage 7. Great dryness of hair, calcarea, calicard, medurinum, soranum, sulfur and thuja. Falling whiskers, calcarea, graphitis, calicard, natmure, phosphoric acid. Falling genital hair, natramure, nitric acid, selenium and zincum. Unruly eyebrows or too hairy, medurinum assist of hair on limbs also, but particularly thuja. Medurinum assist of hair on limbs also, but particularly thuja. If on child face, calcarea, natramure, soranum, sulfur. Animals hair, the quality and sheen of hair may be improved with arsenic, which is used to make glossy and coats of horses and dogs. Glossy the coats of horses and dogs. Girl case, first case, girl of 23-year age, greatly worried over sudden sprouting of thick hair on arms and legs. Otherwise healthy, left ovarian pain at menses, early scheme. I give him Thuja 30, one dose. Pain has not returned and hair growth has definitely decreased until it is hardly visible. A boy of 9, skinny, pale, mossy hair, tubercular history, moles, excessive sensation of heat, craving for hair, ravenous appetite, osteomyelitis and restless, difficult disposition and aversion to people. Medicine give fluoric acid 1 m 1 dose. Disposition follow disposition miraculously changed. Parents says fever subsided, gaining weight, hair has more life and Baldness glints in it. Uppermost osteomyelitic opening healed, lower one on ankle open and discharging, restlessness bone. Later received Thuja 1 m 1 dose. My view, the objective symptoms found in surface of the body as color and texture of the skin and its appendages like nail, hair may give clue to reach the simillimum. I have not found any more literature where mathematic diagnosis on the basis of nail and hair can be done. We have not developed regarding this field of framing totality. More observation and statistical data collection is necessary to come to confirmatory opinion. Thank you.
Thank you, Dr. Vivek, for a very nice presentation and a lot of information on nails and hair. Few of the case you presented, it would have been much better. We could have get a better sense of the case if we could see the pictures as well. And but the approach is beautiful that we need to compile the different cases of the same nature and kind, so that we can get a more practical perspective on certain speciality in the medicine and treatment. So I would request all the viewers to uh, write your questions in the chat box so that we can have a Q&A session following the presentation by the next speaker. Without wasting any more time, I would like to invite our second speaker of the session uh, on the topic rheumatoid and its homeopathic treatment by Dr. Pralay Dutta. He is a district consultant in the public health, and let's welcome him. So over to you, Dr. Pralay Dutta.
Hello. Yes, thank you. Hello. Yeah. Thank you, Dr. Himanshu. I am Dr. Pralay Dutta. I am very much thankful to the NIH Alumni Association for giving me a chance to present my topics. Respected all my teachers, all my seniors, respected President Dr. Kalyani sir, and all my beloved batchmate and my juniors. Today I'll going to share one topic that is rheumatoid arthritis. Very common and very good topic for this our homeopathic point of view, and also I have seen one very good topic from Dr. Bharti. It's very good approach from Dr. Bharti for his contribution. So I am Dr. Pralay Dutta. I am BHMS from 12th batch. I have done my MBA in healthcare service from Sikkim Manipal University. Now I am working as a consultant in public health at Darjeeling district under Department of Health, West Bengal government. So rheumatoid arthritis. Rheumatoid arthritis, as we know, arthritis means arthro means joint and itis means inflammation. Rheumatoid arthritis is an autoimmune disease in which the normal immune response is directed against the individual's own tissue. Normally, immune response should be against the antigen, the outward, all the germs. But here, this faulty immune system in our body that develop the rheumatoid arthritis. That includes in the joint, tendons, and bones, resulting in the inflammation and destruction of this tissue. But I want to say that this is not a joint pain. This is more than this joint pain because it's the autoimmune disease and it's a systemic illness. There is also some extra-articular systemic symptom it's developed in later stage. Commonest inflammatory joint disease seen in the clinical practice affecting approx 1% of population, characterized by the persistent inflammatory synovitis leading to cartilage damage, bone erosion, joint deformity, and at last it may develop disability. As per Harrison Internal Medicine, the definition is a chronic multi-system disease of unknown etiology characterized by persistent inflammatory synovitis, usually involving peripheral joint symmetrically. It's unknown etiology. Differential diagnosis may be the gout, maybe the SLE, systemic lupus erythematosus. It may be psoriatic arthritis, which is developed from the psoriasis later stage. Any type of infective arthritis, osteoarthritis, or it may be the sarcoid. So first we have to understand the anatomy of joint. Here the anatomy of joint, we can see there is the articular or hyaline cartilage is there, act as a shock absorber. Sorry, here this hyaline cartilage as a give our joints protect from shock, allow the friction-free movement, is not innervated. There is no nerve supply of particular hyaline cartilage. And another is synovial membrane or synovium, and this secretes the synovial fluid, which is a lubricating fluid for this joints, and this nourishes the cartilage and cushion of the bone. So this is very important. This articular cartilage and synovial membrane, because for this rheumatoid arthritis, this both is damaged slowly. Overview is it can be happen in any age, but commonly it's seen in third to sixth decade of life, and female are more prone than the male. It's 3 times more prone to develop this disease. Pattern of joint involvement could be polyarticular and symmetrical. Mainly this in this disease, there are single joint involvement is very rare, and the most common is diarthrodial joints. That means that joints which move more, which have a free movement, like small joints, most commonly PIP joints, MCP joint, proximal interphalangeal joint, and metacarpophalangeal joint, wrist, ankle, knee, metatarsophalangeal joint. These are the commonest involved joints. These are the small joints in our body and develop this inflammation. This oligoarticular is most less commonly, and monoarticular is rarely it's found in this rheumatoid arthritis. The main diagnostic feature is the morning stiffness. Morning joint stiffness is the main feature. It may be the 30 minutes, maybe after means more than 1 hour, and after some physical activity, it becomes is easy. Small joint of the hand and feet are typically involved. Now the clinical manifestation. Clinical manifestations is mainly articular and extra-articular. We can see in the picture, this is the articular joint. Most commonly involved joints are marked as round dots. Pain and swelling the affected joint aggravated by movement is the most common symptom, and morning stiffness is more than 1 hour is very common and diagnostic features of this disease. So see some joints like sacroiliac joint, temporomandibular joint, acromioclavicular joint. These joints which are less mobile and rather it's fixed type of joint, less involved in this rheumatoid arthritis. And there are some percentage of involvement as in different type of joint. MCP metacarpophalangeal joint and proximal interphalangeal joint of the hand and metatarsophalangeal joint of feet is mostly involved, is about 90% of the cases. Knees, ankle and wrist are also involved in 80% cases. Shoulder joint is 60%, elbow is 50%, and other than this less mobile joints like temporomandibular, acromioclavicular and sacroiliac joints are less, like 30%. Don't forget the cervical spine is spine also involved in this disease, but mainly cervical spine is more involved, like thoracolumbar or sacroiliac or distal phalangeal joint are not involved generally. These are the picture of inflamed joint. If we can see that this joint PIP joint and MCP joint inflamed, and there is, we can see the regularly there is we can found the tenderness, we can found the swelling of joints in the mainly this MCP and PIP joints. This is the deformity. You can see in ulnar deviation. This fingers deviated in the ulnar side. That is called the ulnar deviation. This is the late case of late untreated or maltreated case of rheumatoid arthritis. Develop this type of deformities. There are two deformities we can see. One is first, it's seen in the fingers. First is Bonnier's deformity, that is also called pain holding deformity. It's like a this finger become bent, it's unfixed. It cannot be extended in a straight. It's like a pain holding manner. It deformed and it become a pain holding manner. So it's also called pain holding deformity, and we call it Bonnier's deformity. And another, we know that very common in this rheumatoid arthritis is a swan neck deformity. Swan neck the finger become carved like a swan neck like deformity. It's actually it become the PIP joint become extend, and proximal part is extend and distal part is flexed. So it gives a swan neck like curvature. See another swan neck deformity in a case we found in the clinic. Extra-articular manifestation is very important because this is systemic illness is present in 30 to 40% cases, may occur prior to arthritis also. Patient more likely to get high titers of rheumatoid factor anti-CCP, and there is also HLA DR4 pattern of positive, and the male are more prone to extra-articular manifestation. Early onset of disability also may be there, and if there is any addiction, there will be chances will be more. Extra-articular involvement, in the extra-articular involvement, we can see constitutional symptom is very most common, like fatigue, like weakness, cardiac symptom may be present, maybe eye symptom, dryness of eyes also may be there. A hematological finding, rheumatoid nodules maybe. We have some pictures of rheumatoid nodules also in next slide. So there is 30% chance of getting chances of this rheumatoid nodules. Hematological finding, generally it's there is anemia, but it normocytic normochromic type of morphology we can see in the blood pictures. Leukocytosis and leukopenia both can happen in this type of hematological picture, and of course thrombocytosis is the features in late stage we can see. Felty syndrome, one syndrome we called is Felty syndrome, when we get this chronic nodular rheumatoid arthritis, splenomegaly, and neutropenia. These three features, if we'll get, we call this Felty syndrome. Although it's not very common, it's a rare phenomena, but we can get in case. Extra-articular involvement, as per if we'll find out, if we'll categorize in organ-wise. So first we'll in the respiratory system we can get the pleural effusion, pneumonitis, pleuropneumonary nodules, and ischemic lung disease. In the case of cardiac symptom, there may be asymptomatic pericarditis, there may be pericardial effusion, and cardiomyopathy. And rheumatoid vasculitis is very much important in extra-articular manifestation. Mononeuritis multiplex, cutaneous ulceration, digital gangrene, and visceral infarction may be there. We can get the Raynaud's disease also. Raynaud's disease also, symptom like Raynaud's disease also we can found. Central nervous system, we can see the peripheral neuropathy, cord compression from axonal to mid-cervical spine subluxation, and entrapment of neuropathies. Eye, there is also eye symptom in case of rheumatoid arthritis like keratoconjunctivitis sicca, where and episcleritis and scleritis. Mainly commonly we found the dry eyes due to decreased lacrimation. These are the picture of rheumatoid nodules that commonly we found in late stage of rheumatoid arthritis. And the common site is it's in the maybe in the elbow or maybe in the ventral part of the hand, palm, opposite of palm. Rheumatic nodule, these are the small subcutaneous nodules present in the extensor surface of the hand, wrist, elbow, and the back of the rheumatoid arthritis patient. Characteristic feature of rheumatoid arthritis, a marker of disease activity. If there is a rheumatic nodule, that we can see that disease is very in active stage. It can be present even in other features of rheumatoid arthritis absent. So only by rheumatoid nodule also we can diagnose the disease by this rheumatoid nodules also when there is no rheumatoid arthritis other symptoms present. Laboratory investigation. In laboratory investigation we find the if the complete blood count we have to do complete blood count where already we get anemia and sorry this the ESR is also very much important for marker of this activity of disease, and CRP also is very C-reactive protein or high sensitive C-reactive protein also very important for this marker of the disease. GBP also is very much important for this marker. Some interleukin is we can find out in autoimmune active autoimmune state in acute phase reactants, that is interleukin 6, that we are very much this IL-6 is very much we done in like a COVID situation. Rheumatoid factor, of course, rheumatoid factor is one of the major mostly commonest test done in rheumatoid arthritis, and we found in diagnostic value. Anti-Ccp antibody, there is also one antibody, that is anti-cyclic citrulinated peptide, that is anti-Ccp. This is very diagnostic, have a good prognostic value of this test. If this we found this anti-Ccp positive, that there may be of deformity in the late stage can be happen. So this anti-Ccp antibody have a great value in to treat this rheumatoid arthritis. Radiological reports is very important in case of to diagnose the deformities of the affected joints. Rheumatoid factor, the commonest and mostly we diagnose by this rheumatoid factor, this test. This is blood test. In case of if it is more than 20 international unit per ml, we say it is positive, and the highest the marker, highest the value, higher the disease active stage we found. Can be any isotype of immunoglobulins. It may be the IgM, it may be the IgG, it may be the IgA or IgE. 85% of the patient with a RA over the first 2 years become RA positive. So there may not be all cases will be RA positive, but still they can be they can be positive. But we will get the RA factor negative. So other symptom also we have to keep in mind that later I will present. I have a slide for this. And prognostic value, patient have with high titer of RF rheumatoid factor in general tend to have a poor prognosis and more extra-articular manifestations. Cause of positive test of RF rheumatoid factor in other case also we can get positive, like Sjogren syndrome, like vasculitis such as polyarthritis nodosa, sarcoidosis, systemic lupus erythematosus, chronic any type of chronic infections like chronic liver disease or other chronic type of infection like tuberculosis, bacterial endocarditis, infectious mononucleosis, leprosy, syphilis, leishmaniasis, and also malignancy and old age. 5% women aged above 60 may be present with rheumatoid factor positive. So only the rheumatoid factor positive, we cannot say this is a rheumatoid arthritis. Anti-CCP antibody. Anti-CCP antibody is a type of autoantibody that works against our body normal antibodies. This is the IgG against the synovial membrane peptide that damage via inflammation. So more the damage, more will be this marker will get. Sensitivity it is 65% and specificity is 95%. So both the it have a already I have told the both diagnostic and prognostic value of this anti-CCP antibody is for this rheumatoid arthritis is very much valued. This is a prediction of erosive disease, disease severity, radiological progression, and poor functional outcome we found in case of high anti-CCP antibody positive. And there may be high chances of deformity and disability of this anti-CCP positive cases. There are lots of acute phase reactants are there. Lots of tests are there. May not be that much important. Important mediator, ceruplasmin, complement C3, C4, hepatoglobin, fibrogen, or ESR. CRP is very much valuable for active inflamed condition of joints. If there is a active joint involvement, we we can guess by the CRP test. That is elevated APRs like ESR and CRP, thrombocytosis, leukocytosis, ANA, anti-nuclear antibody 30 to 40%, inflammatory synovial fluid, and hypoalbuminemia. Radiological feature: periarticular osteopenia, uniform systemic joint space narrowing, marginal subchondral erosions, joint subluxation and joint destruction, and ultimately it may be the collapse. Ultrasound defect is defect early soft tissue lesion. MRI has a greater sensitivity to detect synovitis and marrow changes. We can see this in this radiological picture. This joint space become reduced highly. There is also ulnar deviation in the metatarsophalangeal joints. Sorry. These are the diagnostic criteria of rheumatoid arthritis. This is called Acr Diagnostic Criteria, American College of Rheumatology Diagnostic Criteria. There may be first is morning stiffness, more than 30 minutes or 1 hour, arthritis of 3 or more joints, arthritis of hand joint, symmetric arthritis, rheumatoid nodule, serum rheumatoid factor, and radiographic changes. A person shall be said have rheumatoid arthritis if he or she has this 4 out of the 7 criteria. If there is a 4 points will be we have to find out in any case to confirmatory diagnosis for rheumatoid arthritis. The criteria 1 to 4% at least 6 weeks. There should be a 6-week coefficient. Morning stiffness there should be 60. Arthritis should be at least 6 weeks. And arthritis of hand joints also there should be a 6 weeks presentation. Symmetrical arthritis also have to present for 6 weeks. So this is very important. Joint involvement, there is some score also there. This is called ACR score or Euler classification of score. This by this score, if it is more than 6 or 10, we can say it is a case of rheumatoid arthritis. 1 is large joint, 2 to 10 large joints, 1 to 3 small joints is giving the score 2. 4 to 10 small joints we will give 3 score. More than 10 joints it will give 5. Serological negative RF and negative anti-CCP will give 0. Low RF or low positive anti-CCP will give 2. High positive RF and high positive anti-CCP antibody will give 3. Normal CRP and normal ESR will give 0 score, and normal abnormal CRP and normal ESR will give 1. This is called APR, acute phase reactant. Duration of symptom, if it is more than less than 6 weeks, we will give 0, and if it is more than or equal 6 weeks, we will give 1. So it's very important that we have to find out any case of joint we will suspect rheumatoid arthritis. So first we have to ask this question whether he or she have this more than 6 week sufferings or not. Now the management part, a very important part of this. Goal of management, first goal is lifestyle modification. As we told, there is this is genetic disorder in is chromosomal abnormality. So there sometime we say, okay, homeopathy patient will come that they think that in homeopathy there is cure for disease, but we have to be loyal about our medical profession that there is no cure of rheumatoid arthritis. So if the patient, we will give the patient for pain-free life for prolonged duration or prolonged, so that will be a good part of this treatment. So we have to assure the patient that if we'll treat properly, patient will be long time disease free, pain free, symptom free, and there will be no chances of deformity. So rather we say like this way, rather than we'll say that we'll cure the case, because it's a genetic disorder and autoimmune disorder. So there may not be a cure of this disease, lifelong cure. So lifestyle modification is very much important. Focus on relieving pain. Pain management is very much necessary. Preventing damage or disability of various joints. This is also very important. Patient education about the disease is very much important, that I told. We have to educate the patient about the disease, what is type of disease, and pain. Sometimes patient think pain is the disease, but pain is not the disease. Disease, pain is the only symptom of disease. So we have to give a proper idea about the disease to the patient. Physical therapy for strengthening and range of motion exercise. Exercise is very much important to mobilize all the joints properly. Occupational therapy for splints and adaptive devices is very much important in case of deformity, or if the deformity is started initially. Treatment should be started early and should be individualized. This is also very important, individualized. There is different type of cases and different type of disability, from less to high to highest disability. So no two cases are alike, and this is our beauty of homeopathy. We always individualize all case. Goal of management in lifestyle modification, first we have to make a good habit because it's a systemic illness and we have to give the patient is very good fit in entire life. So balanced diet with routine life is very much important. Without any irregular diet, irregular life habit, sleeping habit or irregular diet habit is may cause low lack of means immune response. So make have a, this prognosis will be very bad in case of that. Whole grain diet is very good because it contains the high fiber and high mineral for every joint is very important actually. Citrus food is very much important because citrus food contains the vitamin C, which is necessary for synthesis of collagen in connective tissue. So in all the connective tissue, tendon, periosteum, and bone is very much important to this collagen have a great important role in joints. So citrus food is very much important. So we have to ensure the patient to take lots of citrus fruits. All fruits contain the antioxidant that fight against the inflammation. This is an inflammatory disease, so we have to give the patient the role of antioxidant and all fruit. Olive oil is very good for this type of rheumatoid arthritis because olive oil contains oleocanthal, which is uh, like give the pain-free life, which suppress the pain pathway, like non-steroidal anti-inflammatory drugs. So it can be olive oil can be the alternative of this NSAID. So we'll suggest to take olive oil rather than taking other oil. Pineapples is very good for this rheumatoid RA patient because pineapple contain vitamin C, of course, and bromelain. Bromelain is very good to reduce the pain and inflammation, and all the our good herbal uh, uh, products like ginger, herbal herbs are very good, like ginger, tulsi, turmeric, garlic. As we know, these have a good um, um, have a good effect in our inflammation that have a lots of antibiotic type of effect. And calcium rich food is very much necessary, and green leafy vegetable is very much necessary because there's joint deformity, so we have to ensure the calcium. And also we have to ensure the vitamin D. So early morning sunlight is very much necessary, I think, in case of rheumatoid arthritis. Early morning sunlight has good ultraviolet ray, and if we'll expose ourselves in the early morning in we suggest the Surya Namaskar, early morning Surya Namaskar in we called USA. In early mornings, Surya Namaskar is very good for giving the patient very good positive effect. Intermittent fasting is very much important if have a if the person is obese. Light diet at night. Weight management is very much necessary because weight bearing joints like knee, elbow, and ankles also involved in this case. So weight bearing joint weight management is very much necessary for management of this disease. To avoid is very much important alcohol, red meat, and red meat, and we have to restrict all the addictions. Food that causes allergy, we should avoid food from the refined cereals like biscuits and any type of fast food. These are from the refined cereals, which is not good for our health. So taking the whole grain is very good. because that whole grain contain high um, uh, minerals. So we have to avoid the refined cereals. Food causes weight gain like high calorie diet, ice cream, cold drinks, and other fatty, oily, fast food. Overeating in the late hour in the night is very much have a bad effect in the weight management. And of course we have to be mentally free from all this depressions and anxieties, and so we have to be mentally free. So we have to be strenuous activities, we have to restrict, and lifting heavy weight also, those who are doing the gym, so they have to restrict their heavy weight lifting once we'll diagnose this case. Regular exercise, brisk work as much as possible when movement is painful. If the painful joint is there, we have to do at least some work, or if whatever as much as possible. Stress, depression, already I have told. Yoga as meditation is very much helpful for giving this proper uh, immunity. Disease activity assessed by several parameters. Duration of morning stiffness. We can find out the severity of disease by these points. Duration of morning stiffness. Once the disease will progress, morning stiffness will be progress. Tenderness of joints. We have to count. Swollen joints. We have to count. Observe global assessment. Patient global assessment is necessary. Either patient is as a whole is very good, healthy or not. Visual analog scale is for pain. We generally used to take visual analog. Health assessment questionnaires we can give to assess overall health. Inflammation marker value, ESR, CRP. This inflammation marker we can have a great value to diagnosis, prognosis. Pain management is assessment. Also, we have to we can guess the disease severity, and how much painkiller, if the patient will come from the modern medicine, then how much painkiller he is taking regularly. That is also give some idea of disease activity. Some pain management, homeopathic management is very much, we have a good, all the, lots of medicines there in homeopathic management for pain. So first, I'll say that we have to give all miasmatic and constitutional treatment for all the cases. So I cannot discuss this because it will be more elaborated. So we have to find out the miasms behind this case. If it is asymptomatic, then we can say it may be psoriatic or psychotic. If there is acute inflammation, more it will be the psoriatic. And if there is destruction, deformity, we can think about our syphilitic drug. And also in case of some other symptom, we can give some tubercular drug also. So different kind of miasmatic and constitutional treatment is very much necessary for to control the overall disease progress. So, but today we'll give some idea about some pain management. There are lots of pain management medicine to give the pain management. Rheumatic pain, we first pain means we can first we can keep in mind that Arnica montana is our first and foremost pain medicine. Is very good and very effective for in acute cases in pain management. Arsenic, aurum natronitum, Pediaga, benzoic acid, Bryonia, causticum, chamomilla, chelidonium, colchicum, formica, and Caliide is syphilitic drug. Calmia, lachesis, lycopodium, medurinum, Sorry, yes, spelling mistake. Uh, Phytolecca, Pulsatilla, Rhododendron, Rastox, Sanguinaria, Sarsaparilla, Sulfur. There are lots of drug, many other drug also there. Shifting type of pain, if we'll characterize some pain, there it may be shifting type of pain. We can think about autumn carbonium salt, kali salt, lac, sorry, spelling mistake, lac and also some pulsatilla also. Uh, if it is rheumatic pain, aconite, bridea, colchicum, marxol, rastox. Lidampal is very good medicine for joint pain. Joint is red, swelling, stiff, stitching pain from slightest motion. Rheumatism begin in the lower extremity and ascend. That is opposite of calamia. And calcarea carp. In case of calcarea carp, we can see this feet is constantly damp and cold, as he have a damp stocking. Actias spicata is very good medicine for small joint affections, small joint inflammation, as wrist, fingers, ankles, toe joints, and it's aggravated after fatigue. Arthritic nodule formed. If arthritic nodule formed, then we can think about lidampal, apis, benzoic acid, lithium carb, calcarea floor. If it is this stony hardness, if stony hardness present. Coldness of the upper limb, we can think about belladonna, phosphorus, pulsatilla. Coldness of forearm, we can think about graphitis, phosphorus, and bromium. In case of icy coldness, we can think about bromium. Camphor, lidum, and sickle core have a coldness of limb but intolerance to warmth. There are some medicine with symptoms. Actia spicata is very good medicine for a small joint and wrist rheumatism. There may be paralytic weakness of hand. Amin Mur is very good medicine where the contraction of hamstring tendon. In case of sciatic pain, neuralgic type of pain. Apis is very good for any type of inflammation, as we know. So we can, if there is cellulitis, synovitis, and apis like a feature like thirstness, of course we have to general features we have to keep in mind. Slightest motion in aggravate and warmth cause aggravate, absolute rest and cold application also give amelioration. Arnica montana is very good medicine for joint, any type of joint pain. First we have to think Arnica montana, and I generally prefer the higher potencies in case of pain management, 1 m, 10 m, 50 m, and it's pain increase in movement and rest. It's relieved by rest. There is chances of previous history of trauma. Belladonna also very good medicine if we'll find out very high redness and plain inflammation and severe pain. Belly spar is very good medicine, very good medicine. Have a debility in limb, muscular soreness, lameness. Remedy of old labor, as mentioned in the Boric by Barnett, is mentioned that old labor or gardener, those who sit in the gardens with bending the knee, so there is weakness of knees found in this belly spur. Benzoic acid we know is very good medicine for acute gout and gouty rheumatic diathesis. We maybe found this great toe pain, swelling in the wrist, and special type of urine characteristic of benzoic acid. Bryonia alba is very good medicine where the slightest motion aggravate and absolute rest give this and pressure give this relief to the pain. Calcarea carb already I discussed. Simisi puja is very good medicine for rheumatic pain when the people are very nervous and we having severe kind of pain and less tolerance of the patient, less tolerance of the patient. Gaultheria is very good medicine in case of inflammatory rheumatism with sciatica and other neurologic symptom. Gelsemium is also a very good medicine where we will find the numbness, paralyzed, dizziness, and very weakness, prostration. Also, arsenic also a very good medicine where the burning we found the burning like arsenic and restlessness and weakness. Lapanilam is very good medicine in rheumatism and sciatica and numbness, where we'll find the cramp and chronic muscular rheumatism. Guaiacum is also a very good medicine. We give this guaiacum in tincture or low potency arthritic diastasis, rheumatism, and where we'll get stinging pain of the limb, arthritic lanceratic pain, a feeling of heat in the limb is, and the typical aggravation time is 6 p.m. to 4 a.m. in night. Hypericum, where the pricking type of pain and tingling type of burning type of numbness, we can think about the hypericum. Calmia is the opposite of ledum, opposite of calicum, is leaning forward, giving the uh, aggravation, and pain shifted neurology. Pain shoot downwards, yes, pain shoot downwards with numbness. Opposite of ledum is pain, where the pain goes upwards direction. Lactanthis is mainly stiffness of the knee, neck, cervical part. Ledum is very good medicine, opposite of calmia, where this pain is in lower limb and then ascends. Lithium carb is a good medicine when we'll find out the heart disease with the rheumatic pain with rheumatic nodule, uric acid diathesis also. If the patient have a high uric acid, we can think about lithium carb. Pulsatilla have a good pain character, like more the pain, more the chill. I have cured one, not cured. I have given relief to the patient dramatically by this pulsatilla. Only by this symptom, more the chill, more the more the pain, more the chill. So patient will feel more chilled or coldness when the pain will increase. If we have the character like pulsatilla, we can give this pulsatilla is very good result. Rhododendron, we know that is any stormy weather give the increase of pain on inflammation. Then we can think about rhododendron. And important features: cannot sleep unless the legs are crossed. Straight only can sleep by the legs are crossed. Rastax is very good medicine. We generally prescribe. Ruta also we generally prescribe in tendons and cartilage deformity and injury. Symphytum is very good for periosteum. Periosteum, especially in case of neuralgia and bony pain, and if there is also bone injury or fracture, we can give those symphytum. And we have to think about some modern medicines also. Last but not the least, what are the medication? Because all the patients are coming from other rheumatologists, so we have to know some modern medicine also. Um, uh, so normally steroids and NSAID and disease modifying drugs also we generally prescribe in modern medicine. Immunosuppressive therapy is very much important in modern medicine. So biological therapy and surgeries at last. In the NSAID, we know there's some common, all the analgesic have a side effect of gastrointestinal problems. And the corticosteroids is a steroid which is have a generally given for this pain management, but this is also have some side effects like uh, These are the commonly used methotrexate, hydroxychloroquine we seen in this. This is used HCQS in COVID time also, COVID patients also. Sulfasalazine or this type of medicine also given for this treatment of this, uh, and leflunomide also given for this type of cases. There is also some doses also, which is not very much important to us. But one thing I want to mention here, that hydroxychloroquine HCQS is generally given to control the immunity, autoimmune disease, any type of autoimmune disease. These are the disease modifying factor in modern medicines. And methotrexate generally find out in brand name of Polytrex, which is generally given to control this type of immunity response. And this severe problem is this myelosuppression or this bone marrow depression is associated with this type of drug. So in case of I want to mention this important thing, that patient, if some come to us with taking this type of methotrexate or HCQS, we have to do blood. We have to check the blood parameters, that whether any blood uh, uh, means chances of bone marrow depression is there or not. Any chances of less blood count, then we have to think about blood hemoglobin, blood transfusion, or any given to any medicine which can increase the blood. And sulfasalazine is also found by the name of C.H.S. C.H.S is also have this type of features of myelosuppression, and also may reduce the sperm count. Leflunomide also, we can found in brand name of Lefno, is giving some side effect of hepatotoxicity. So there are lots of things may not be necessary. Which is necessary, I told already. This we have to check the blood parameter once patient will get. Also, we have to check the eye. Also, if any vision difficulties or not, because this all the medicine have some and disease also have some important destruction in destructive features in eyes. Uh, Cyclosporin also have used in this type of, these are the immunomodulators or immunosuppressive drugs. These may not be necessary. And surgical approach sometime necessary once this deformity, if this extreme deformity, and in case of deformity is causing disability. Thank you.
Thank you, Dr. Pralay Datta, for your very nice and excellent presentation. Your focus on the fundamental aspects of rheumatoid arthritis were very informative. Your discussion regarding homeopathic treatment of rheumatoid arthritis have highlighted many important aspects. Your special points on goals of management, you talked very nicely about the lifestyle modifications, and you discussed many valuable points from our clinical practice purpose. One perspective I would like to add here is regarding diet with the rheumatoid arthritis. in any chronic disease, Henneman's two principle of diet are very important, which is worth reading. If we see in the Friends of Health, he talked about two principles. One is the principle of individualization, that is, uh, the diet should be individualized from person to person, and we need to see his subjective sensitivity to different articles of food. And the second was the principle of moderation, where he talked of that anything should be taken only in moderation and nothing in excess. These two are the grand principles that he used to practice in dealing with the chronic cases. Regarding the cure that rheumatoid arthritis is incurable, I agree with you. In most of the modern medicine literature, that is what it is written. But from our clinical experience, I would like to say we encountered three types of rheumatoid arthritis from homeopathic perspective. One is that arthritis cases without deformity, but with good clinical totality. Here, the long-term remission is a very common outcome. The second type of case that we get is the rheumatoid arthritis with deformity, but with a good totality. Here, a good clinical relief of the patient is the most common outcome if we get the good indicated remedy. And the last, the rheumatoid cases with deformity, but a very poor totality, uh, it's a nightmare for clinicians. So we get all these three spectrum of cases from homeopathic perspective, and we should, I think, we can frame our prognosis from our totality and our philosophical aspect. Now, if I have to add a few points to your excellent presentation, I would like to also hear and learn from you regarding your clinical experience in dealing with the rheumatoid arthritis, both challenges and success. You discussed very nicely about the acute phase and the valuable indication of the most commonly indicated remedy. But again, we would like to hear more from you on this. In the chronic case, regarding approach to the rheumatoid arthritis, I would like to also see more focus on the experience about standalone treatment of rheumatoid arthritis with homeopathy. And at what point in case you switch to the add-on therapy and you allow the patient to take NSAIDs or steroids or DMRD, disease modifying anti-rheumatic drugs such as methotrexate and biologics. And last but not the least, when a patient while undergoing a conventional allopathic treatment, what is your approach to them? How you wean off the medications and which of the medicine you wean off first and which one you do in the last. Overall, it was a very great presentation and left us all wanting for more. Now, let us move to Q&A session. Uh, we have one question from Dr. Archana. This question is to Dr. Yes, this question is already displayed on the screen. Thank you, Orko, to help us. The question is, sir, you directly mentioned remedy for baldness, Beraita. We can give that to any baldness patient. I think Dr. Vivek would like to take this question. Over to you, Dr. Vivek Bharti.
No, but a curve is not given on this possibility, but on totality, I will give beta curve medicine for the baldness.
Thank you, Dr. Vivek. Of course, we'll go as per individualization and as per the indication. Thank you. Now,
Okay, Masuda.
is there any question? I think there is no further questions. So
No, there
let's
is
move.
no further question.
Yeah, yeah. So this Q&A session uh, can be further taken up by writing any question to the chat in the YouTube also, I think, and the
Yeah,
speakers will be very happy to reply there also. And so let's wrap the question Q&A session. Uh, Before handing over the screen to the more able hands, let me congratulate again to both the esteemed speakers, Dr. Vivek Bharti and Dr. Pralay Datta, for enlightening us from their very valuable presentation and experience. I'd also like to thank Dr. Kalyani sir for sparing his valuable time for almost all the CMEs conducted so far. Last but not the least, the efforts of Bidyuta and my dear Orko cannot be over highlighted. They are the strongest pillar of the CMEs. And thank you all. Thank you, the viewers, speakers, and everyone. Over to you, Bidyuta.
Thank you, Dr. Himanshu, and both the speakers tonight. It's an excellent session. And my humble request to all the viewers, all the alumnus, do come forward. Never hesitate to be a speaker in the CME. That will be highlighted by Kalyani sir. But before that, on a regular procedure, we used to go for an appeal. Through this online CME, we are trying to reach almost all the alumni across the globe and our homeopathic fraternity across the globe. So we need to share these CME sessions with all the people whom we are in touch and who are believing homeopathy and who are practicing homeopathy and we are willing to practice homeopathy. For the alumni part, our request to all the persons, we are having all over the globe now over 2000 alumni. But till date, we are somehow managed to get in touch with around 700 alumni across the globe. So there are 1500 plus alumni are yet to join the alumni group of WhatsApp, Telegram, or any other social media. So it's a humble request to all of us to be united and come together. What another Pralay, Dr. Pralay Sharma, the popular face of NIH since his college days, used to say that you are a student for 5.5 years, including internship in UG, or a student of 3 years during your PG. But, and obviously not to say we as juniors to them, our seniors, Kalyani sir's batch and all the deep NIH, 2 years. So post that, we all are alumni for our rest of our life. So let's come together, be a united family across the globe, and we should be together. For that, we are already organizing and having our bank account in NIH Alumni Association, which has been mentioned in the description of the CME every session. And our alumnus are requested to come forward, get your membership. It's nothing but 100 rupees per year, starting from 2010. After you pass, those who had passed in 2020, there it's 100 and 100, 2 years, 200. Those who had passed before 2010, that is like us, we had passed in 1995. For us also, it is from 2010 till 2022 and beyond. It's 100 years per 100 rupees per annum. Moreover, we had started on with our benevolent fund. We had been trying to be by the side of our alumnus who are, we are getting information, who are in distress or in severe crunch or need. We are trying to be by their side every time, and it has been decided by a committee wherever we are having, headed by our President Kalyani sir, Dr. Pralay Sharma, and our backup team of the CME, Dr. Shekhar Pore, Dr. Om Priya, Dr. Kishore Noshkar, and all of you who are been a part of this 47 CME till date. So please come forward and donate on that benevolent fund, whatever amount you feel, apart from the membership fees, 100 rupees per annum. Now it's over to our President Kalyani sir to give his valuable remarks, which always enrich us with our knowledge, and wrap up the session and close it. Over to you, Kalyani sir.
Thank you, Bidyut. Many thanks for your endeavor. Many thanks for today's inaugurator, Dr. Karuna Roy, for nicely inaugurating the program, this 47th CME. Many thanks to our beloved Dr. Himanshu Shekhar Tiwari for nicely moderating the session. Very nice. And we are really thankful and we are very happy for the excellent speakers, Dr. Pralay and Dr. Vivek Bharti, for giving their valuable speeches and beautiful presentation, brief and to the point. Almost every corner had been discussed in this CME. I just like to add a little bit to encourage all of us. Firstly, for Vivek Bharti, I like to tell you that, brother, please tone up. What subject you have chosen, in my opinion, within a very short decades, you will find there will be a separate stream of cosmetic homeopathy. Because nowadays you must agree that people are, to some extent, somehow everybody's fate. Population has been controlled. Financially, every person of the world is gradually gaining their strengths. So now whole population will gradually indulge to cosmetics and entertainments. In that respect, what is my experience, and you also agree with me, that the cosmetic treatment in homeopathy system of medicine is very soft, widespread, very effective. Within a very short time, we will see people will hanker for homeopathic cosmetic treatment. In that respect, regarding skin, nails, hairs is very important. You must agree with me that in conventional system of medicine, in master degree final examination, if any MD student, he fails to see the nails of the patient, he will not be allowed to get passed from MD examination. Such an important field is nail, because nails is not only a part or appendicular organ, but it is a very significant organ to reflect cardiopulmonary disorders, severe disorders of cardiopulmonary, hormonal, and many other things, as we have heard from his speech today. Not only that, skin, nails, and hairs are from such a germinal layer from where endocrine system and nervous system develops. So neuroendocrinological reflection is severely expressed in skin and nails and hairs. So this is very wide and very significant areas to see the nails, hairs, and skin. You'll be happy to know, in Calcutta Homeopathy Medical College, we had one teacher. He used to teach pharmacy, head of the Department of Pharmacy, Professor S.P. Shah. Whenever in OPD, a patient will come to him, he will just hold his hand. He will rub his hand on the palm. He will see the nails, the skin, while listening his or her complaints. When you ask that why you are taking the hands and rubbing on hands, seeing the nails and skin, he told, grow up, you will learn how much important is this. To feel the skin of the palm and skin of the hands, to see the nails, to see the temperature of the skin, to see the shape of the nails and palm is very important. You will learn in your future. Really, by studying gradually, now I am very sure that this is a very important field to see indications of constitutional symptoms, which is not being made with a very short period, but this hormonal, neurohormonal, endocrinal changes gradually changes or gives shape, size, deformities, pathology of nails and skin. There's another doctor. Many of the Calcutta practitioners and senior doctors, they'll be knowing, many of you might be knowing, Dr. Hassan. He was to practice in Hooghly district. Patient used to stand on a queue from the early dawn, and he used to sit on a stool or a very short chair. all patients are asked to be barefooted. They will go before the Dr. Hassan. Dr. Hassan will see the toes and the fingers of the palm. He will prescribe the medicine on the paper. Patient is seen within 1 or 2 minutes. Hundreds of patients he used to see daily simply on depending on nails, indication of nails. It seems to be astonishing, but if you study Mathematica, you will find the reflection of nails in different constitutional drugs are very, very significantly presented in proving, during proving. So, what is my opinion that this cosmetic homeopathy is need of the very near future. So please, brother, improve yourself, study, get toned up. The need of your approach is very much needed in near future. Now, regarding the speech of Dr. Pralay Dutta, rheumatoid arthritis is a very, very significant point and a very challenging disease of the world. You must agree that conventional medicine has got simply managements, somehow manage the conditions to reduce the pain, to give a pattern of life, but there is no treatment. More hazard is that if one continues conventional system of medicine, they invites double risk. The disease rheumatoid arthritis is usually autoimmune or congenital. That means immune system is usually being controlled by the RE system and liver. So because they are sick, not in proper state, that's why autoimmune fighting between the own proteins have started in the body, resulting to rheumatoid arthritis. And unfortunately, the drugs given to control the immune system disorders are all hepatotoxic and orthopedic toxic drugs. That means the drugs, once they are taken, liver is further going to be damaged or functionally disturbed. So both way, patient is inviting risk of hepatic and other diseases, ophthalmic diseases, if they continue conventional system of medicine. In that respect, definitely homeopathy has got some says. You will be encouraged to know that fortunately, I was working on degenerative joint disease on more than few hundreds of cases in NIH under the guidance and protocol of Professor S.C. Day. You might be knowing. Department of Medicine, he used to come in the OPD by seeing homeopathy on joint diseases. He inspired us that why to start a research project to show the scientific world that your homeopathic medicine can cure these type of diseases. So while treating degenerative joint disease on hundreds of cases, it was published in Bulletin, National Institute of Homeopathy Bulletin. You can see it. We found incidentally few RA cases. It was taken into consideration. Professor, they also told these cases are not curable. We simply manage. You have better management system by homeopathy medicine. Do not lose your strength. Fight on. Let us see what happens. Under his control, his supervision, I tried, and you'll be astonished by constitutional medicines, plus sometimes by some palliative drugs to control the situations, severe pains and other complaints. Majority of the cases, except 1 or 2, either the case was controlled or the case was better serologically and clinically. Complaints are coming down, anti-CCP, RA factors, level is coming down. Other complaints are going off. And you'll be further astonished to know that rheumatoid arthritis is curable. We have seen, I have the documents of NIH OPD that RA factor has become negative, anti-CCP has become negative. Patient is clinically free from the complaints. Not only this, we were completely able to all the patients to stop taking conventional system of medicine by homeopathic treatment, by constitutional and occasionally whenever it is necessary acutely, some palliative drugs. So it is obvious, you can try of your own, that constitutional medicine definitely can stop taking allopathic medicine, but there should be a technique. What we did, that slow withdrawal, infuse homeopathic system of medicine see improvement of other complaints and other systemic improvements like sleep, appetite, and other things, then you are confirmed that your medicine has started working. Clinical complaints are not deteriorating, either stable or to some extent less or fluctuating. Then you gradually, very slowly withdraw the allopathy medicine. And you are able to stop allopathy medicines ultimately, except I told you 2 or 3 cases. That is a great improvement without any serological changes. Means serologically conditions are not deteriorating, slightly fluctuating, but clinically patient is improving. And she or he was able to stop allopathic system of medicine. So you must believe, you must agree that homeopathy system of medicine is still surviving in the world for left out cases, refused cases. For the cases, it has been given in the literature incurable cases, either autoimmune or other some genetical other diseases. So it is we who can try our level best to fight with these incurable and left out cases. So all the brothers, it is my request, take the case history very carefully, bring to the constitutional drug, see the situation, try accordingly. Under the coverage of constitutional drug, you will see the miracle of homeopathic system of medicine. If you want, I can present the documents what I am having for RA factors becoming negative. So this is another chapter not only for RA factor. Gradually, autoimmune diseases are increasing in the world because by drugs, by vaccinations, our immune system, RA system is badly disturbed and disrupted. So naturally, the number of autoimmune diseases day by day it will increase, and day by day the need of the system of medicine which can control the autoimmune diseases or can treat left out cases will gradually increase. So be sure that need of yours gradually coming forward to combat with to tackle with the incurable or autoimmune diseases. So anyway, it's a very nice seminar. Many things we have learned from both the speakers, moderators. We will try our level best to change the views that homeopathy do not say incurable. Homeopathy can definitely try their level best. Whether it is incurable or curable, Hering's law of cure will tell us. Few months trial will tell us whether it's curable or incurable. So without taking any trial, depending on the conventional system of medicine, practice of medicine or surgery, we should not claim this or that case is incurable. Thank you very much for coming and joining with us. Please come and join, share your experiences. All of us will be encouraged excellently. Thank you. Thank you very much.
Thank you so much, sir. And we have a very happy announcement to make. Our 48th CME will be a very emeritus speaker, Professor Dr. Shashikant Tiwari, sir. And to oversee the session, it will be the moderator of the session will be another emeritus professor, Dr. Shamir Kumar Bhattacharya. So stay tuned, and we are expecting our former director, Professor Dr. Abhijit Chatterjee, to be the inaugurator on that session. So stay tuned and be there in our upcoming CME on 48th, which will be staged on 8th of May. 8th of May. And we are having surprises for 49th and our 50th CME. And by this, with permission of Kalyani sir, we are taking you back to our backstage editor, Orko. Over to you, Orko.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. Sorry for that weird cut. I hope you have enjoyed today's CME. And if so, please do make sure to give it a like and share with your fellow homeopaths and homeopathic medicos who are aspiring students also in need. And do follow us on Instagram, Twitter, and like our page in Facebook, and join our Telegram channel. Subscribe our Telegram channel to get more updates on every CME we schedule. And also, it's a humble request to you all guys. I know it will be said later, but So another time we are sorry to say that we were unable to do the quiz program today, as due to some confusion in our IT team. So it is our problem, and on behalf of my IT team, I am extremely sorry for that and apologizing for the inconvenience. And also, if you want to get a e-participation certificate for today's CME, the link is in the description. Just click on that. And also, thank you again for having me, to all the panel members all here. And we will now move on to the post CME talks. So, with this, good night to all the viewers who are watching. And if you want to join in post CME talks, then you have to come as a speaker. So, with this, it's me, Medico Mukherjee, leaving.